Department of Health, Dr. Maria Rosario Vergere, for her keynote speech. A round of applause, please.
Thank you tayo. Good morning to all of you, and thank you for inviting me in this event that you have. Maraming salamat. Of course, to our President of the Association of Medical Social Workers of the Philippines, Ms. Agnes Bali. To our Vice President and Chairman of this convention, Ms. Marilyn Mulia. To the Executive Assistant of Mayor Byron, Mr. Matthew Mendoza. I am joined today by our Regional Director, Director Mario Baquilod. Also joining me here are the, I don't know if hundreds, DOH officials, medical social workers from all of our hospitals and from the DOH Central Office. And I am very proud to be with all of you today, especially that marami po sa inyo ay kasama natin sa kagawaran ng kalusugan. So, salamat po for inviting me into this event. It has long been the department's stance that the works and contribution of our healthcare workers of the Philippines be appropriately recognized, properly institutionalized to be at par with standards and better capacitated to deliver quality care and service to every Filipino. While physicians are expected to manage the patient's illness and its direct contributors, social workers' role is to examine the broader social determinants of health that are at play. As we may know, evidence shows that medical care or management that transpires within a healthcare environment, such as hospitals and clinics, only account for 20% of health outcomes. Majority or 80% are largely determined by social determinants of health, such as education, income, physical environment, and healthy behaviors. This has prompted a paradigm shift in primary care, where from simply addressing the disease itself to also empowering our patients, their families, and their environments to deliver patient-centered care. To do this, we recognize the 8 dimensions of patient-centered care delineated by Picker Institute, which include respect for the patient's values, preferences, and expressed needs. Second would be information and education. The third would be access to care. Fourth is emotional support to relieve fear and anxiety. Fifth is involvement of family and friends. Sixth, continuity and secure transition between healthcare settings. 7, physical comfort. And 8, the coordination of care. Because medical social workers work closely with our patients and families, they are best positioned to deliver these dimensions. Your line of work even directly mirror these dimensions, particularly in providing support, engaging the patient's social support system, as well as ensuring a coordinated care. We recognize the critical influence of these factors, which are traditionally outside the purview of the healthcare sector. Hence, in 2022, we have developed our health sector strategy for 2023 to 2028, which identifies the following strategies. First is to enable Filipinos to be healthy by being health literate and able to practice good health-seeking behaviors. The next is to protect Filipinos from health risk by preventing disease outbreaks and ensuring medicines are safe, of quality, accessible, and affordable. The third is care for Filipinos' health and wellness by building strong networks of primary care and specialist care nationwide, and strengthening healthcare institutions and healthcare workforce through appropriate right-sizing to better respond to our mandates. These strategies are all centered on the goal of shaping a healthier Philippines to better equitable health outcomes through stronger healthcare systems and financial risk protection. As part of our initiatives and strategies under this health sector strategy, specifically the Strengthen Trust, our goal is to bolster the different cadres of professionals serving in our healthcare sector and ultimately improve the quality of direct and indirect healthcare services for all Filipinos. To this end, one of our priorities and my main reason for being here with all of you today is to recognize the contributions of our medical social workers in the healthcare sector and develop plans to formalize, to standardize, and to capacitate your cadre as part of our country's healthcare workforce. Specialization in social work includes child welfare, family counseling, corrections, aging, rehabilitation, psychiatric and medical care, among others, and initially focused only on mother and child welfare. Social workers can now be found across various medical specialties such as oncology, renal, cardiology, infectious, neonatology, neurology, pediatrics, HIV, and women and child protection. Simply put, kayo ang nagsisilbing puso sa pag-aabot ng serbisyong medikal sa ating mga kababayan. Nakita at patuloy natin nakikita natin ito sa ating mga ospital sapagkat ang ating mga medical social workers ang nagsisilbing tulay ng ating mga pasyente para maging abot kamay at abot kaya ang mga serbisyong pangkalusugan. Hindi po ito simpleng pagproseso lamang ng mga dokumento para sa financial assistance. Alam namin na ang bawat medical social worker na humaharap sa pasyente ay kinakailangang may ipinapamalas na malawak na skill set mula sa technical know-how upang maipaliwanag ang mga serbisyo at medical procedures na gagawin sa ating mga pasyente sa pag-a-assess ng kanilang financial and social capacity hanggang sa pag-imbibe ng kalinga na kailangan maramdaman ng ating mga pasyente at kanilang mga kaanak dahil sa bigat ng kanilang dinadala. Hindi lamang po iyan. Malaki din po ang papel ng ating mga medical social workers sa pangangalaga ng mental health ng ating mga kababayan sa ibang mga facilities tulad ng ating mga PRCs. Alam natin ang ating mga medical social workers ay nagsisilbi ding mga counselors na sumusuporta sa ating mga service users. While the 6th edition of the Department of Health's Manual for Medical Social Workers published last year adopted the definition of clinical social work as work in hospitals, public health or social clinics, geriatric, palliative or hospice care, mental health centers, nursing homes, rehabilitative care centers, and agencies that provide financial assistance for medical treatment. We recognize that your roles are not confined to this definition. And hence the definition must reflect the varied roles that our medical social workers are actually carrying out in our healthcare facilities. It must recognize the wide scope of responsibilities that medical social workers are doing. And this in turn will define the needed skills and competencies that every medical social worker must possess. This is precisely what will inform our strategies moving forward, particularly as regard boosting the competencies of our medical social workers in the country. Knowing that your work focuses on addressing the varying needs of individuals, families, and communities experiencing challenges in health and wellness and psychosocial well-being, including assessing the functioning, environmental, and support needs of patients and their families, we will equip and retool your cadre with more comprehensive competencies that will better equip all of you to support the delivery of quality healthcare services in our country. Nakita natin ito lalo na noong panahon ng pandemya, kung saan ilan po sa ating mga medical social workers ay naging kabilang sa ating mga multi-specialty teams sa ating mga ospital na nag-alaga sa ating mga pasyenteng mayroong COVID. Ngunit bago po natin ito nagawa, alam natin na kinakailangan nating magsagawa ng capacity building activities sa ating mga medical social workers sa iba't ibang competencies tulad ng infection prevention and control. And ang layo natin, palawigin natin ang ganitong capacity building at ma-institutionalize natin ang mga programa para sa ating mga medical social workers. Our vision of our medical social workers is clear, and it is reflected in every type of facility and in every level of the entire continuum of care. At the primary care level, we envision our medical social workers as members of our primary care provider teams and principal navigators of patients throughout our healthcare system. That is, in guiding patients through our different levels of healthcare facilities and providing them with the needed psychosocial support as they go through the ordeals of having these illnesses. At the secondary level of care, or our general hospitals, our medical social workers shall assess relevant dimensions of patients and navigate them through the social support system. That is, supporting patients through the processes of different financial support sources. And at the tertiary care level, or our facilities and hospitals that provide highly specialized care, we envision our medical social workers to be part of our multi-specialty care teams that will provide holistic care to our patients, looking after their social and psychological well-being while other cadres address the biophysical aspects of treatment. Likewise, we will look to our medical social workers for continuing support through palliation and hopefully, once patients are better, in preparing our patients for reintegration into our communities. Nais natin na makilala kayo ang ating mga medical social workers more than the current understanding of its practice. Kung ating makikita ang ating medical social section sa bawat ospital, ito ay nakalaan para sa pag-a-assess ng financial incapacity ng mga pasyente. Nais natin pahalagahan na kayo ay kasama namin as clinicians, an integral part of our health assessment. In San Bernardino, California, a 2018 study conducted by Limon found that among the challenges that social workers encounter in the practice are provided insufficient time to complete work-related tasks, large number of cases, and dealing with challenging clients. Medical social workers are members of interdisciplinary teams, which involve working closely with our physicians, nurses, and other healthcare professionals in a fast-paced environment such as a hospital or a clinical setting. Social workers in the country carry the same burden and responsibilities, yet they remain to be undercompensated. There have been multiple initiatives lobbying for the more responsive compensation of public social workers in the Philippines. One such initiative is a bid to amend Section 12 of RA 9433 or the Magna Carta for Public Social Workers, such that the entry-level pay of a junior officer, public social worker, is salary grade 13. Programs in the next decade shall be guided by the National Human Resources for Health Master Plan 2020 to 2040. This provides our policy and strategic directions for the development and management of the country's human resources for health. As we gather today at this annual convention of our Association of Medical Social Workers of the Philippines, allow me to present our plans and initiatives on how we will shape the future of this profession together with all of you. First, we will recognize medical social workers as a health cadre and facilitate the development of standards and basic competencies necessary to undertake the responsibilities of medical social work. Second, we will institutionalize the profession by enhancing your role in the healthcare provider network, including our mental health services. We also will be contributing to the development of programs and curricula with our higher education institutions. Finally, we will capacitate medical social workers by expanding their career opportunities beyond their current roles, which often revolve around bridging financial needs of our patients. We would also like to establish a ladderized program for social workers to create a clear healthcare professional pathway. We aim to recognize all of you, our medical social workers, as a bona fide healthcare or health cadre, considering that all of you continue to be important instruments in providing our healthcare services to all of our patients. Hence, part of our plans in the coming years is to update our current policies cognizant of the contributions of medical social workers as part of our healthcare workforce. In addition, we are currently working with our legislators to champion salary standardization and increase, as well as the provision of Magna Carta benefits to all of our healthcare workers, including all of you. Hindi po namin kayo makakalimutan, kasama namin kayo as part of our health cadre. As the DOH steers the sector into developing integrated practice units, bridging primary care and hospital care, we recognize the role of our medical social workers. This is similar to the practice done in other countries such as the US, wherein they are investing in the establishment and capacity building of collaborative teams, including medical social workers, to screen, to assess, and treat health problems spanning primary care to hospital care. The fact that all of you are not only looking at clinical aspects when providing care, but also the social determinants of health of our patients, it is only fitting that medical social workers serve as the bridge between our primary care providers in our rural health units and our specialists in our hospitals, and finally, reintegrating our patients back to their communities once they are treated. I cannot emphasize more that our success in providing a comprehensive continuum of care is highly dependent on your roles. With this, as we aim to ensure that our kababayans will have access to primary care facilities and services within 30 minutes, we ask your support in being part of our primary care teams. In addition, as we aim to build specialty centers across all of our regions in the country, this provides an opportunity for medical social workers to practice different specialties. Our medical social workers play a role in supporting the mental and emotional well-being of our Filipino service users and their families. As we continue strengthening our healthcare system towards a patient-centered and integrated approach, we also aim to strengthen the role of our medical social workers in providing mental health and psychosocial support services and promoting the well-being at the community level. Recognizing that mental health is an equally important aspect as physical health, the DOH continuously strengthens the provision of mental health care services in different settings. Part of our strategy is to promote our community-based mental health, which do not only aim to make services more accessible, but also transform communities that are promotive of mental health and well-being of our Filipinos. This means that mental health services will not only be limited to diagnosis and treatment, but also will provide psychosocial support, counseling, including relationship building with service users and their families, and also addressing the broader social determinants of health, such as gender-based violence, and instituting social support services, including raising community awareness, setting up self-help groups, and ensuring access to equal social benefits. Hindi na po bago sa mga medical social workers ang pag-aabot ng mga ganitong serbisyo at kalinga sa ating mga pasyente. As we have emphasized, medical social workers address beyond what we can see under a microscope or diagnose from our laboratory results, but you address the entire well-being of an entire person, including their social and psychological aspects. Thus, we see all of you as an underutilized yet highly suitable profession in the provision of all of these services. In fact, training activities have been conducted by both the Association of Medical Social Workers in the Philippines and the DOH League of Medical Social Workers. Over the years, capacitated our medical social workers not only to detect and prevent suicide, but also to respond during disasters and emergencies. This capacity building proved useful during emergencies and disasters, particularly during the time of the Super Typhoon Yolanda in 2013, where medical social workers were among those tapped to provide psychosocial debriefing for our responders before getting or being sent back home. Medical social workers were also assigned to deliver the same for nurses and doctors assigned in our COVID-19 wards during our current pandemic. To ensure that all of you are adequately prepared to carry out an enhanced role in our healthcare system, we will champion with the Commission on Higher Education the improvement of our current Bachelor of Science in Social Work curricula. Part of our work on reorienting health curricula towards primary care. We will ensure that these undergraduate programs will provide you with the health competencies needed to become part of our healthcare workforce. At the same time, we will promote the development of graduate programs on medical social work, including clinical specialties similar to other countries like US, UK, and Germany. In relation to that, we aim to expand the current scope of practice of medical social work in specialty care, particularly in chronic and palliative care, as part of our healthcare continuum. Sa panahong ito, hindi na lamang po doktor at nurse ang pwedeng mag-specialize, pati na rin po ang ating mga medical social workers. In other countries, medical social workers are able to pursue specialized clinical fields such as mental health, oncology, cardiology, among others. We want to emulate this best practice in our local setting here in our country. Aside from championing the development of programs in higher education institutions, we will also include medical social workers in our efforts on specialty certification, similar to our initiatives for nurses and our other health cadres. We want to establish a clear path for medical social work in the country. Nais po natin na may patuloy na pagpapalawig sa ating mga health cadre at kasama na po dito ang career pathways for our barangay health workers na nais magpatuloy sa pagiging social worker. Hangad po natin ang isang ladderized program na magpapatibay ng succession planning natin sa medical social work here in our country. We are currently working with the University of the Philippines to develop ladderized programs for health cadres. In their current ladderized program for nurses, wherein they study midwifery, and then nursing, and then medicine, they have seen a 98% retention rate in the communities that they serve. And we want to replicate this success with our medical social workers. Through such program, we will be able to facilitate the professional development of our medical social workers and hopefully encourage them to be more effective to serve in our communities. Kilala po ang kalidad ng kalingan ng mga Pilipino at namumukod kami ang mga manggagawang pangkalusugan kagaya natin at kagaya ninyong lahat. Ito ay natatanging kalinga na hinubog din ng ating kasaysayan. Nais po natin na mas maipalagala pa ang kailangang ito, ang kalingang ito, lalong-lalo na po sa lahat ng ating kababayan dito sa ating bansa. With our policies and initiatives underway, I invite all of you to realize our collective vision. A healthcare system which empowers allied healthcare professionals and puts primacy in building their capacities. I believe that we all share the same passion of having a universal and accessible healthcare system for everybody. We hope that today's event can bring us all together to achieve our common objectives. We will learn from all of you just as much as you will learn from us, which is why we are all happy to have you as part of our pool of our healthcare workforce. And we look forward to working with all of you to lay the foundations for a resilient and responsive public healthcare system, exemplifying the brand of care that Filipinos are best known for. Muli, congratulations to all of you on this annual National Convention. Maraming salamat. Taus-pusong pasasalamat sa inyong lahat, especially during the time of the pandemic, sa lahat po ng sakripisyo, sa lahat ng inyong ibinigay para po maalagaan natin ang ating mga pasyente, sa lahat ng naitulong ng mga medical social workers sa ating healthcare system sa ngayon, and of course, sa entire healthcare sector. Maraming salamat at patuloy po natin pagtulong-tulungan na maitaas ang antas ng serbisyong pangkalusugan, maitaas ang antas ng career ng ating mga medical social workers at makilala ang ating mga medical social workers na kasama natin isa sa mga pinakamagagaling sa buong Asia at sa buong mundo. Maraming salamat po and congratulations to all of you.
Thank you so much, Dr. Bergere, for the inspiring message for all of us. We, indeed, the medical social workers, plays a vital role in our society. And now, Enzo Ward, the Plaque of Appreciation. May I call on the President of the ALSOB and the Vice Chairman. The Association of Medical Social Workers of the Philippines hereby award this Plaque of Appreciation to Dr. Maria Rosario Bergere, Officer in Charge, Department of Health, in grateful acknowledgement of her distinguished and valuable service rendered as keynote speaker during the AMSOP National Convention 2023 with the theme Strengthening the Core Competencies in Clinical Social Work Practice, hereby contributing immeasurable to the prestige and success of the event. Given this 19th day of April 2023 at Princess Garden Island Resort, Puerto Princesa, Palau.